Hi, my name is Asia Tullen, and in this video I'm going to talk about how I can use the clinical judgment model when caring for a patient at the end of life. This model has 6 steps that help nurses make good decisions, such as noticing important signs, making sense of them, deciding what's important, thinking about possible solutions, taking action, and checking to see how things turn out. First, I would start by looking for important signs in the patient. This might include pain, breathing changes, tiredness, or restlessness. I would also pay close attention to how the patient and their family are emotionally. Sometimes they may feel anxious, afraid, or unsure of what's going on. Listening and being present is very important at this time to the patient and the family. Second, I would try to understand what these signs mean. For example, if the patient is breathing fast or grimacing, this may be an indicator of pain. If they are very quiet or withdrawn, they might be depressed or scared. These are clues that would help me know what type of support is needed. Next, I would figure out what's the most important to focus on. Comfort is usually top priority in end of life. I would also think about whether the patient and the family understand the patient's plan of care. If not, helping with communication and education becomes a priority as well. Then I would come up with ideas to help. These could be giving medications for pain, lowering anxiety, adjusting to the room to make it more peaceful and comfortable, and either also calling in extra support like a chaplain or a social worker. I'd also make sure any spiritual and cultural needs are respected and given. After that, I would take action. I would give the care the patient needs and work with the healthcare team like physicians, if needed, PT, OT, to make sure we are all on the same page. I would also speak up for the patient's wishes if they can't do so themselves, making sure that their choices are honored. I would finally see how things went. Is the patient more comfortable, or is the family feeling more supportive? I would reflect on my care and think about what I can do better in the future. Every experience basically helps me grow and become more thoughtful and, makes me more of a caring nurse. So using the clinical judgment model in the end of life helps me stay focused on what the patient truly needs. It helps me make decisions that are not only safe but smart, but also kind and respectful. This is a very special moment for not just the patient, but also the family and someone's lives. And it's my job to make sure that they feel cared, valued, and heard. Thank you.